Now we're going to see the disorders of the respiratory system. The first one is the asthma. Usually we'll call it as bronchial asthma because it affects the bronchi and bronchioles of the lungs. Okay, so it causes, here it causes inflammation. Okay, so what are the signs of inflammation? Inflammation means nothing but swelling will be there, or redness will be there, or local increase in temperature will be there. These are the signs of inflammation. Consider this as the bronchi. Okay, you all know bronchi, respiratory tract epithelium is a pseudo-stratified ciliated columnar epithelium, isn't it? Okay, that is the mucosal part. Okay, so now this mucosa undergoes swelling. So this is a mucosa. Now it undergoes swelling like this. It bulged out like this. Because of this bulging out of the mucosa, the air will not be able to enter very freely. So it results in a musical sound that is called wheeze sound. So wheeze is seen in asthma. Okay, it happens because of the narrowing of the airway due to the inflammation of the bronchi and bronchioles. The second disorder we are going to see is the emphysema. So emphysema affects the structural and functionality of lung. That is the place where the gas exchange takes place. That is nothing but alveoli. Okay, so see in this diagram, the red areas are the bag-like structure is alveoli. The red areas are the one where the alveoli walls are damaged. So because of this damaged alveolar wall, gas exchange won't be efficient here. Okay, so that is this condition is called emphysema. So one of the risk factor for emphysema is smoking. Smoking causes emphysema. Another disorder that we will study in the 12th standard, okay, alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin protein will be there. If that is deficient, these alveolar walls will be damaged. So these are very important question. Emphysema affects the alveoli of the lungs are affected in emphysema. Third disorder we are going to see is the pneumonia. Okay, so pneumonia is a infectious condition. Pneumonia is an infectious condition. It affects the which part of the lung? It affects the lung parenchyma. It affects the lung parenchyma. It affects the lung tissues. It's a infectious condition. It can be caused by bacteria, virus, fungi, etc. The fourth one we are going to see is the occupational respiratory disorders. It is very common in grinding or stone breaking industries. Okay, so usually respiratory epithelium is a pseudo-stratified ciliated columnar epithelium. What is the function of cilia there? To expel the waste particles outside, isn't it? So whenever that defense mechanism is failed, what will happen? The waste particle will enter and it will go and settle in the lungs. Okay, see in this diagram now, this is the yellow color is a waste particle. It slowly enters the trachea, then it enters the primary bronchi and it goes and deposits here in the lung. Okay, so whenever any waste particle enters our body, our immune system will be activated. It will cause inflammation. After a long time, it will cause fibrosis. Fibrosis means it is surrounded by a fibrocytes that will produce fibrous tissues. So this is called fibrosis. This is called lung fibrosis. Whenever lung fibrosis happens, what will happen? That part of the lung won't be able to take part in the gaseous exchange. So that is the thing happening in the occupational respiratory disorders. So it's very common in grinding or stone breaking industries. So whenever dust enters the lung, first inflammation will happen. Why inflammation happens? It is because of activation of our immune system. When long-term inflammation, it results in the fibrosis. Fibrosis means that part of the lung will be decreased in size, so it will affect the efficient gas exchange. So lung fibrosis or pulmonary fibrosis will happen. Okay, then results in decreased efficiency of gas exchange. So this is the thing happening in the occupational respiratory disorders. Okay, we can prevent this by wearing protective mask. Okay, that's all.